The world of food and health can be incredibly overwhelming. Everyone seems to have thoughts and opinions on what to eat and why. All of the information coming at us is a lot. Getting to the specific information that you want can be hard, and making sure the information is credible is difficult but vital. There is no end all be all solution. There's only you, who you are, and what works for you. So let's zoom in a little to a more specific topic than just health and wellness. Today, we're going to be looking into how the Mediterranean diet affects the health of those with PCOS based on several different studies. But first, we need to define the Mediterranean diet and PCOS. The Mediterranean diet is characterized by eating lots of fruits and vegetables, whole grains, healthy fats such as virgin olive oils, nuts, and seeds, legumes, moderate amounts of fish, small quantities of natural dairy, low consumption of red meat, and moderate amounts of wine. The Mediterranean diet is incredibly popular and is often referred to as one of the healthiest diets. The health effects of the Mediterranean diet are increased cardiovascular health, increased brain health, weight management, and sustainability, both in terms of the fact that the foods being eaten are sustainable, as well as the fact that the diet itself is pretty sustainable and not overly intense. What is PCOS? PCOS, or polycystic ovarian syndrome, is a disorder characterized by polycystic ovaries, hyperandrogenism, and anovulation. Hyperandrogenism is when there's an excess of androgens, sex hormones, which prevent the ovaries from maturing and properly growing follicles. It causes coarse hair growth, acne, irregular periods, balding, and more. Polycystic ovaries are ovaries that produce too many androgens and have fluid-filled sacs or cysts on them. These cysts are follicles that haven't matured into eggs. Anovulation is when that because the follicles aren't mature, the eggs aren't getting released, causing irregular, absent, or extended periods. Some complications or symptoms of PCOS are diabetes due to insulin resistance, infertility, heart disease, high blood pressure, high cholesterol, inflammation, and more. PCOS is an incredibly complex health issue because many of the systems feed into each other and exacerbate each other. For example, because of the hormonal nature of PCOS and the effects it has on metabolism, those with PCOS are often overweight. Being overweight or having insulin resistance can exacerbate hyperandrogenism, creating cycles that are incredibly complicated and hard to break. So how does the Mediterranean diet affect PCOS and the health of those with PCOS? Let's research. We're going to look into 3 different studies and see what conclusions they come to. The first study's goal was to investigate and evaluate the diets and impact of the diets of those with PCOS, specifically looking into inflammation. It was a case control study done on 527 women. There were 325 control and 202 women with PCOS. The participants had a variety of different parameters measured through a variety of labs and questionnaires. Participant characteristics, serum measurements and laboratory measurements, collection of follicular fluid and measurements of the oxidative stress levels, and dietary assessment. There was then an assessment of dietary patterns, an assessment of the inflammatory potential of each diet, and analysis. 4 different dietary patterns were identified: the Mediterranean diet, a meat-egg diet, a shellfish-shrimp diet, and a staple food soybean diet. What were the results of Study 1? The DII was negatively correlated with the Mediterranean diet. The Mediterranean diet was significantly associated with the reduced risk of PCOS. The Mediterranean diet was considered a protective factor for PCOS, an association between an inflammatory diet and the risk of PCOS. The second study's goal was to study and assess the effectiveness of an intervention program based on the Mediterranean diet without caloric restriction and increased physical activity to change selected anthropometric parameters in women with PCOS or Hashimoto's disease. This was a 10-week intervention study. There was a 10-week program where 14 women with Hashimoto's disease, 15 women with PCOS, and 24 women in the control group had their nutritional status measured before and after. Then a diet intervention by body composition, degree of implementation, and the principles MD by using the MedScore toolkit and level of physical activity by the IPAC-PL questionnaire. The results of study 2. If you look at the results of study 2, you can see that body weight, BMI, waist circumference, hip circumference, WHR, adipose tissue percentage, muscle mass, med diet score tool, and IPAC were all measured. The PCOS before and after this intervention all had increased parameters. The third study's goal was to measure the metabolic and endocrine effects of the ketogenic and hypercaloric Mediterranean diet in women with polycystic ovarian syndrome. This was a human pre-post intervention study. The study was done at the Gymnastic Health Center and was a 45-day program where 80 women with PCOS were split into two groups, had certain parameters measured, then followed either the keto or the Mediterranean diet and had those parameters measured again at the end. Let's look at the results. Almost everything measured was positively changed by the diets, keto more so than Mediterranean. Let's look at the things that changed. The anthropometric measures, such as body measurements and weight, all changed. The lipid profiles, such as triglycerides, cholesterol, HDL, and LDLs, all changed. And the endocrine parameters all changed. And these all changed positively. If you look at the endocrine specific on this data set here, you can see that the pre and post measurements of the keto group are more significant than the pre and post Mediterranean group. That being said, the Mediterranean group still has a positive outcome. So what are the conclusions? The Mediterranean diet is a protective factor for PCOS and associated with a reduced risk of PCOS. The Mediterranean diet can positively affect many markers, including anthropometric, lipid profiles, and endocrine parameters. It's perhaps not as effective as the keto diet, but is more sustainable long term, which can make it more effective for certain people. As we said before, it's all about you and who you are and what works for you.